What causes hypercoagulable states in nephrotic syndrome? Mechanisms and implications for medical students, nursing students, and medical professionals. Question: what is nephrotic syndrome, and how is it related to hypercoagulable states? Answer: nephrotic syndrome is characterized by significant proteinuria, hypoalbuminemia, edema, and hyperlipidemia. It leads to hypercoagulable states through the loss of anticoagulants in the urine and the accumulation of clotting factors in the blood plasma. Question: what causes the loss of anticoagulants like AT3 and alpha-2 antitrypsin in nephrotic syndrome? Answer: in nephrotic syndrome, the glomerular filter becomes more permeable to proteins, leading to the loss of anticoagulants such as AT3 and alpha-2 antitrypsin in the urine, which can contribute to a hypercoagulable state. Question: how do clotting factors like factor VIII, von Willebrand factor, fibrinogen, factor V, and factor VII accumulate in the blood plasma in nephrotic syndrome? Answer: the liver increases the synthesis of these clotting factors as a response to hypoalbuminemia in nephrotic syndrome. Additionally, the urinary loss of anticoagulants leads to reduced inhibition of these factors, causing them to accumulate in the blood plasma. Question: what is von Willebrand factor, and how does its accumulation contribute to clot formation in nephrotic syndrome? Answer: von Willebrand factor is a glycoprotein that mediates platelet adhesion and aggregation. Its accumulation in nephrotic syndrome, due to increased synthesis and reduced inhibition, enhances clot formation and contributes to a hypercoagulable state. Question: how does fibrinogen contribute to the hypercoagulable state in nephrotic syndrome? Answer: fibrinogen is a soluble plasma protein that is converted into fibrin during clotting. Its accumulation in nephrotic syndrome, due to the same mechanisms as von Willebrand factor, leads to increased clotting in a hypercoagulable state. Question: what therapeutic interventions might be necessary to manage hypercoagulable states in nephrotic syndrome? Answer: interventions may include anticoagulant medications, monitoring of clotting factors, lifestyle modifications, and coordinated care with specialists to address both the underlying nephrotic syndrome and the associated hypercoagulable state. Question: why is understanding the mechanisms of hypercoagulable states in nephrotic syndrome important for healthcare professionals? Answer: understanding these mechanisms is crucial for the diagnosis, prevention, and management of thromboembolic events in patients with nephrotic syndrome, ultimately improving patient outcomes. Further information: the complex relationship between nephrotic syndrome and hypercoagulable states requires careful consideration by healthcare professionals. For more detailed information and clinical guidelines, consult specialized nephrology textbooks, research articles, or authoritative online sources.